Welcome back to the Morning Show here on Arise News. The role of men in fertility and family planning in sub-Saharan Africa and indeed Nigeria is becoming increasingly important in the context of raising contraceptive prevalence and reducing level of fertility.
Well, to examine the role of men in family planning with particular emphasis on men's sexuality, knowledge and attitude to contraceptive use is Dr. Habeeb Salami, a medical doctor with a specialization in obstetrics and gynecology with more than 10 years of experience in public health project management and monitoring as well as evaluation. He joins us now from our Abuja studio. Good morning, doctor. Thank you so much for joining us.
Good morning. Thank you for having me.
Great. So a lot of times we hear this conversation about family planning, prevalence of contraceptive. It is always centered around the woman. Why is this so? Why is there not so much said about the man's role in family planning, and how important is this?
Yeah, thank you very much. Over the years that we've been aware of family planning and family planning services, all the methods that have been available have largely been directed at women. And so men generally think family planning is a women affair, so they usually don't get involved. And unfortunately, they are not getting involved as affected the rate at which women do take up family planning services. As we know, men are the decision makers, in the head of the family, and so the decision makers in the family. And if they don't support the woman in terms of our family planning option and being able to access family planning services, the woman will not be able to take up such services. And that has largely affected our contraceptive prevalence rates in Nigeria. It's one of the lowest in Africa, and there are a lot of reasons behind this. There have been myths and misconceptions around family planning methods. There have been, challenges with sociocultural barriers. But more importantly, with regards to what we're talking about this morning, is also husbands' aversion to women taking up family planning services.
All right, Dr. Habeeb, let's talk about those things, or those methods probably that men can use, to be able to support their wives when it comes to family planning.
Well, so largely for family planning methods, we have those we call the natural methods and the modern methods. The natural methods are, withdrawal methods, calendar methods. This also includes the barrier method, which is commonly the condom that we know. Of all those methods, the condom happens to be the commonest that men are involved in when it comes to family planning. So a lot of them, even as it is, do not like using condom. They want to have sex without having condom on. So that limits the number of options that men have in terms of really taking up family planning methods. The greater methods are available, particularly the modern methods, are directed towards women. There are still some research going on to try to see if they will be effective in men in terms of those modern contraceptive methods. But as of today, most of the modern contraceptive methods are, directed towards the women. And so men are not largely involved when it comes to family planning services.
In your opinion, what is driving population growth rates despite the economic challenges Nigeria seems to be facing?
Yeah, so if we take it from the men's perspective, we naturally believe that men don't want to get involved in family planning, but it's actually not so. They are not involved because they don't have information. And as head of the family, the decision that I will take or you will take would largely depend on the amount of information that is available to you at that time. So if you don't have the information, it's going to be largely a decision that is taken based on what is available to them. they don't know most of these methods. They don't know what the advantages are to the women and to the family. And so they usually are not in support. The best they will do is, if they finally agree, is to give the woman money to go to access those services. But if they are provided information, then they will be able to, understand the implication of family size and the development of the home, the community, and largely the nation. In days before, in the old days, family size tends to be high because a lot of our fathers and forefathers were working on the farms, and they need a lot of people to help them. The children they have are the easiest they can get to work with them on the farm. Also, during those periods, child survival was very low. And so the women would rather want to have as many as they can because they don't know how many of them will survive. But things have changed. Child survival now has improved. And we see now that, for example, Nigeria, the rate at which we are growing, government cannot provide for everybody. Things are not available for everybody. Schools are not enough for the population. The healthcare facilities are not enough for the population. And that's because we are growing at a faster rate than we can manage ourselves. And even though we don't want to look at family planning from the perspective of population reduction, but if we limit it to the family and what the father and the mother can provide for the children, that will help in determining how many children they want to have and will have. Even when they have made up their mind that this is the number of children they want to have, if they don't have access to family planning services, then it's going to be difficult because you are not going to ask the couple not to have sex. And if they're going to have sex, the chances that the woman will get pregnant is very high if she's not on contraception. So that is why women need to have access to contraception, and men need to be involved in this. They need to have the information. They need to be able to, depending on how time permits them, accompany their women to the health facilities, be involved in the counseling, help in the decision in terms of coming to a decision on what methods will be preferable for the woman, and follow up too.
Okay, real quickly, Doctor, should we have a national roadmap towards reducing fecundity, as it were, in our families in Nigeria in general, in men? Should we think of using something like the Chinese approach, because obviously our population is beginning to cause a big problem now, as we cannot provide for the population?
Well, I am not going to, I'm not a government official, and I'm not going to be talking for government in terms of how they want to go with regards to population reduction. But we don't advocate for family planning as a tool for population reduction. If we take it from the family unit and advocate that family decides on the number of children they can cater for, I think to a very large extent that will help us in managing our population. I can confidently say, for example, here in Abuja, that a lot of couples are planning their families without going to getting anybody to talk to them because of school fees. So now, if you want to make sure that your children go to school and have the best in terms of education, and you are somewhere like Abuja, Lagos, Port Harcourt, you know that nobody needs to tell you that you need to manage your family size.
Well, we do need to do some family planning, especially with the men getting involved. Thank you so much, Dr. Habeeb Salami, for coming on the show today. Much appreciated. Well, that's been the show today. I am Adesua Omorwan.
And I'm Rufai.
Goodbye.